What qualities have you guys had to develop working in emergency medicine? Is there like anything specific you can think of that's helped you navigate it and avoid burnout and do this job?
I think one skill that I kind of wasn't expecting to have is just how much multitasking sometimes has to happen. And I've heard people say that it's not really like multitasking. It's mostly just rapidly shifting between focus. And I think that's probably a good way to describe it. And I think for me, at least, and other people are just naturally good at that, but for me, that was a challenge. And it even today still can be. So I think one of the skills that I've been really trying to develop to fix that is just trying to be in the chaotic realm that we work in, trying to be as organized as I can in my mind. And so, like for an example, in the ED at least, if I'm working an actual shift, we have a track board, right? Where we'll see all the patients on there. And so like getting into the habit of just reviewing that track board every second I can have. So, okay, so where are we at with this patient? Where are we at with this patient? And keeping myself organized to then be able to task switch so quickly and not just lose it. Mm-hmm. I mean, I remember, so one example, when I had just started, I think this was my first year in emergency medicine, I was working, I was in Indianapolis working at one of the Trauma One centers down there, and I had like 12 or 13 patients on my board, which was like right there at the edge of what I could juggle. And I remember I was going to go order a medicine for this one patient, and then I got interrupted because another patient came in and had some issue. And it took me some time to realize, oh man, I didn't put in that med. And then the nurses came over and said, hey, I thought you were going to put in that med. Even today, that sometimes will happen. But what I try to do is like reviewing that track board just to be able to keep yourself as organized as possible. I think that was a skill that I didn't expect. I assume it probably can translate into, pre-hospital world too, but just trying to find ways to checklist yourself and repeatedly do that to keep on track. I think that was a skill that I've been trying to work on.
And figuring out like which tasks, because I mean, at any given time when you've got 12 patients, there's a lot of tasks that need to be done, and you're like, what's the priority I need to do them in? Well, that one just came in by ambulance, probably need to go do that as number one priority. They have no orders in, no providers laid eyes on them. So I'm going to get up from my chair, whatever I'm doing, go see the ambulance first. That should be the higher priority. And then, okay, this patient's resulted. We need to get them discharged or admitted or whatever needs to happen. This one needs Zofran. I mean, it's hard to balance all those tasks when there's a constant stream of them and figuring out what the priority is too. Mm-hmm.